Hi, Prof Ram. Can we catch you for a quick interview?
Hello, how are you?
Good. Can you introduce yourself and what you do at NUHCS?
Yeah, myself, Dr. Ramanathan. I work here as a senior consultant in Cardiothoracic Care unit. Yeah, I look after sick patients.
I heard that you were recently involved in a research project. Could you tell us more about it?
Yeah, we had an interesting research that was done on heart failure devices, especially devices that are used in acute heart failure and the patient is in a shock state. We call such situation as cardiogenic shock. And when patient has severe cardiogenic shock, you end up using mechanical circulatory support devices, what we call as NUHCS devices. Now, there are a lot of devices available at our disposal, and our research essentially threw some light on which device is the best in this context.
So how does your research project show different treatment options for patients with cardiogenic shock?
Yeah, to give you that perspective, I need to tell you what are the devices used in cardiogenic shock. So when a patient has heart attack or heart failure and their BP starts going down, we give them medications, and if it doesn't improve, we use these NUHCS devices. So different devices we use or we have in our armamentarium include IABP, we have devices such as ECMO, and then we have devices such as impeller, which can be used in such scenarios. A lot of the times we end up using a combination of these devices. So with this in the background, we set upon to find out which device works best in these critically ill patients. And for that, we looked at the literature at about 38 different studies, that do high quality studies. There were about 48,000 patients in all these studies altogether who ended up needing one of these devices or a combination of these devices. And what we found out eventually was that a combination of ECMO with intra-aortic balloon pump, the ECMO IABP, gives better survival benefits compared to the other NUHCS devices. So it's an important finding that we need to take note of. Of late, there have been a few negative trials that has come out saying some of the NUHCS devices do not work. In that context, this positive finding that NUHCS devices, at least certain combinations of these devices work, becomes very important.
So what's next for mechanical circulatory support research?
Yeah, it's very promising. At least after our paper was published, we had the Lancet publishing a similar paper saying that NUHCS devices work in cardiogenic shock, which is promising. Again, the same kind of questions which we raised as to which device, what is the optimal timing, still remains unanswered. And there are a few randomized controlled trials that would be coming up this year and early next year, which would answer some of the questions which we have posed from our research.
Thank you, Prof Ram, for sharing so much. Hope to catch you again next time. Thank you.
Thank you.